All right, so we are now recording live. I'm just going to say this so everyone can hear it for the recording. My apologies. I have my camera turned off today. I just had surgery on Monday on my nose and my jaw. I'm extremely swollen and I cannot breathe out of my nose. So I'm going to sound a little crazy, but I feel perfectly fine. But yeah, so it's going to be a little bit different from usual. So my apologies. Hopefully you guys can still get all of this valuable information. And anyone coming in, if you're not already muted, it looks like pretty much everyone's mute at this point. Perfect. Just because that will cut down on distractions if we don't hear, the background for everybody. Okay, guys. So today we are going to be covering lies and cholesterol.
That
All
was
right.
really good.
Oh,
You know,
I
like
still got somebody,
all the songs.
still got somebody unmuted here. I'm not sure who it is. Tried to go through and find it. Okay, I think we're good to go. Okay, so welcome, and soon you will see why I am calling this class the lies and cholesterol class. You're going to get a lot of interesting information today, I think. And just to kind of give you a little bit of an introduction here, we do have a free class every single month from myself, Pharmacist Jamie. Next month's topic is currently being voted on inside my app. If you subscribe to the app, you go ahead and put in your vote. It looks right now like the topic is probably going to be constipation and diarrhea. That currently has the most votes. So that is tentatively our class for next month. Also, every single month, there is a bonus class for my app subscribers only. February 18th, 2 weeks from now, that class is going to be Stop Being a Stress Mess. It's going to be all about stress and anxiety. I like to have the two classes for each month to kind of relate to each other. So I figure heart disease and stress go together really well because a lot of times stress is at the core root of why we are getting some of these heart conditions and issues. All right, stick around until the end and you will get a free gift like always. And you'll also get some more information on some potential lab work for those who are interested, just to kind of assess your risk even further. All right. So I guess I should introduce myself. You guys probably already know me. I'm Pharmacist Jamie. You've probably seen me on social media. I've been a pharmacist for over a decade now. I'm also a certified FMACP. I just really enjoy trying to help people with their health in whatever way possible. And I started doing these webinars, and I got to tell you, it has been one of the most rewarding things. I really, really
I'm
enjoy
in the webinar for the next hour,
interacting with you
but
guys in
otherwise,
this way. So I really appreciate you guys taking time out of your day to be here. Thank you so much. As far as what we're going to cover today, we're going to cover some basic human anatomy and statistics. That's going to be the lies and cholesterol part. We're going to talk about how you can better assess your risk of cardiovascular disease through advanced cardiac labs. And we're going to talk about treatment and prevention of cardiovascular disease. This is just my standard disclaimer that I always give you guys. Now, it's really exciting. I'm actually the healthcare provider for several of you now, which is great. But for most of you, I am not your healthcare provider. So this is just for
this
informational
is here for
purposes.
you, so
Um,
you could
oh,
listen to it, so you
somebody,
don't get a heart attack like I did.
somebody is unmuted. I'm not sure who. Let me try to find.
Huh?
Go. I'm not sure who that is. Oh, there we go. Okay, I think everyone's muted now. Um, okay, but anyway, so yes, I am not the healthcare provider for most of you. So this is just for educational and informational purposes for you to take back and talk to your doctor about. Because I don't have your health history. I don't have your disease history, your medication history. I have no information. So your situation could be very different from the typical situation. So do not take this as a prescription for what you need to do with your life. This is more like a guideline to have educated conversations with your doctor. Okay, so some interesting statistics. Oh, I got somebody else unmuted. There we go. Okay, so some interesting statistics, which you guys probably saw this on social media, but I really want to drive this point home of how cardiovascular disease truly is a silent killer. It comes up on most people unaware. A lot of people think that I'm going to know about this well ahead of time. My cholesterol is going to start to be out of control. I'm going to be short of breath. I'm going to have heart palpitations. I'm going to have all of these signs that show me that I'm at risk. And that is just not true for the majority of people who end up with cardiovascular disease, especially those who end up dying of cardiovascular disease. A lot of times it is completely out of left field. No one had any idea. So as far as statistics, cardiovascular disease is the #1 killer of men and women inside the USA. This is more so than all of the cancers combined. I mean, guys, think of how many walks we have for breast cancer or ovarian cancer or leukemia. Like, we have so many fundraising things in order to bring attention to those, which is wonderful. I love that education in any capacity about your health. But this is bigger than all of that combined. And I think that a lot of times we just kind of think it's inevitable and we don't really try to do that much to address it and fix it. We just pop a pill and call it a day. And that is not the best way to handle this situation. It is not inevitable. Also, it is not just a men's disease. This kills one woman every 80 seconds in this country. A lot of times we kind of have this. Oh, hold on, let me see who's unmuted here. A lot of times we kind of get this idea that it's the stressed out guy at the office job, it's the executive, it's the guy who's working 80 hours a week and da da da. This strikes women equally, just as it does men. Okay, this is not a men's disease. All right, this is a person disease. Um, and then also 2/3 of women who die suddenly of coronary artery disease had no signs or symptoms. Okay. There we go. Okay. So 2/3 of women who die suddenly of coronary artery disease had no previous symptoms whatsoever. Like I said, you guys, this is something that can sneak up on you absolutely out of nowhere. In fact, 75% of heart attack patients who end up in the ER had cholesterol levels on standard panels that did not even indicate that they were at risk. Okay. And this is just an article here from UCLA Health. This is not like some fringe theory of like, oh, we're not doing this enough. This is like very reputable places talking about the fact that we are really bad at assessing our risk of cardiovascular events. It's just not something we're great at. So let's try and educate people and change that a little bit today. Okay, so some basic anatomy. The heart is a muscle that pumps blood, and usually the heart itself is not the problem. Now, it certainly can be. A lot of you, brought up that you want to talk about arrhythmias, you want to talk about heart murmurs, you want to talk about all of these like structural defects that can happen with the heart. These things certainly happen to lots of people, but in the vast majority of cases, it is not a structural defect within the heart. It's usually the tubing. It's the arteries coming from the heart that end up being the problem and that cause sudden death out of nowhere. So that's what we're going to focus on today, just in the interest of time, because I can't go over every single potential structural defect that can occur with your heart. So that's where our focus is going to be today. I'm sure that we will do more classes in the future talking about other forms of heart disease as well. Now, for a healthy cardiovascular system, you need a strong heart muscle. You need strong but flexible blood vessels. That's really important. Just think of like a water hose. In the middle of summer, the water hose is like indestructible. It's laying there. You can bend it all around. It's fine. You take that exact same water hose, put it in really cold weather. You could drop it from height and boom, it's going to, shatter into a million pieces. So having that flexibility super, super important. We also want our blood flow at a stable and appropriate pressure, because the cells within the blood, if they are flying through those vessels at super high speeds, that is going to be more likely to damage the vessels. The blood pressure certainly plays a really big part in this equation. We also want blood that does not scratch the inside of your arteries. Now you may be thinking, what? How would your blood scratch the inside of your arteries? What is that about? Well, let's get into it. That's kind of the whole point of the class. All right, so first let's talk about cholesterol. Now you can see this picture on the bottom left-hand side. It's just kind of a really good visual representation of what happens with cardiovascular disease. The healthy artery on the left, there's tons of room. The blood is flowing freely. Everything is working as intended. The partially blocked artery in the middle there, we still have decent blood flow, but as you can see, it's starting to become a problem. This is going to put strain on your heart. Your heart is going to have to work harder. Your body is not going to be getting the oxygen and the nutrients that it needs very well with this partially blocked artery. And then the blocked artery all the way on the right, that is when you are in stage critical. Okay, that is when you are at very high risk for heart attack, stroke, for one of these things that can end up being a widowmaker. Okay, so that is what we want to avoid at all costs. So we all know what cholesterol does to your blood vessels, but why does this buildup happen in the first place? So a lot of people tend to think of cholesterol as like lard. You eat lard, you eat a bunch of saturated fat, it gets into your blood vessels somehow, and it clogs you up. This is not really an accurate picture. So it is partially about 25% of the cholesterol in your body is actually through diet. But that means that about 75% of the cholesterol in your body is actually made inside of your body. So why is your body making too much cholesterol? Why on earth would your body do that, right? Basically, excess sugar inside the blood vessels causes damage. Sugar is sharp little crystals that can scratch the inside of our arteries. And it tends to only happen in the arteries, not so much the veins because of the pressure. Like I said, when it's going at that high speed, it's just much more likely to bounce around and cause more injury. We don't really see this in the arteries so much. But these little sugar crystals cause these injuries and micro tears in the blood vessel walls. Now, the endothelium of your blood vessels, it is so tiny, you guys. It is so tiny that your body will do everything in its power to protect that endothelium. So as soon as it starts to see some scratching, some tears, some injury, it is going to send in the recruits. It is going to put together a spackling of cholesterol, calcium, white blood cells, whatever it can get its hands on, and it is going to put that spackling directly on the damage that is caused by the sugar. Okay, so that is what cholesterol is. It is literally just a tool that your body uses to protect itself. Now, ripping down the spackling without addressing why we needed spackling in the first place is just not a good long-term solution. Now, sometimes it is absolutely necessary. If you've got that blocked artery on the far right there, you're going to have to lower your cholesterol, right? You're going to have to take a statin. You're going to have to do something pretty serious. But if you still continue to have a diet that is high in sugar and have the problems that caused this in the first place, it's going to keep happening. I mean, you guys might have heard me talking about this before, but it's like repairing holes in a boat, right? You see these holes that keep cropping up in this boat. So you're repairing them, you're going around doing each one, but you never check to see what's causing the holes in the boat. You're just repairing each hole as it pops up. Meanwhile, there's a kid on the other side of the boat with a hammer running around, just continuously putting more holes in the boat. So obviously the most effective strategy is to go after the kid with the hammer and get the holes to stop appearing. Then you can address the holes that are already there and truly fix yourself and get back to a place of health rather than just taking one pill after another. So the best way to deal with cholesterol is to keep your blood sugar normal. Then you have no initial damage to your vessels. You have no need for spackling. You have no need to start this entire cascade. That is why diabetes is the #1 risk factor for cardiovascular disease. The two go hand in hand, and hopefully now you can understand that mechanism a little bit better. All right, now let's talk about the lies. I told you guys this is a class about lies and cholesterol. Well, here we go. Big sugar honestly has acted very similar in this country to big tobacco. They have put a ton of money into shutting down research showing how damaging sugar is, while actually trying to portray it as a health and diet food in the past, believe it or not. They have tried to shift all of the blame onto fat. I mean, guys, this was the most fun part of putting this presentation together, is just going through all of the misinformation that has been rampant. This article from NPR on the far left, if you get the chance, please look that up and read it. It is so fascinating. But basically, they sugar industry, Coca-Cola in particular, but fairly, a lot of others as well, they paid scientists a pretty penny to basically lie about their findings and to say, oh yeah, sugar is great. Sugar is a health food. Fat is the problem. What you need to do is have everything low fat. If everyone just eats everything low fat, we're all going to be healthy. Everything's going to be great. Well, as a child who grew up in the 80s and 90s, right in the middle of the low fat craze, remember that, how every thing out there was low fat for quite some time? We are the unhealthiest generation. That was an abject failure. Our health has plummeted since we switched to this low fat, high sugar diet. It has done exactly the opposite of what these scientists who were paid big bucks to lie told us. And guys, look at some of these ads. These were real ads that the sugar industry was running about how healthy sugar is. Sugar just might be the willpower you need to curb your appetite. Are you serious? Sugar keeps your energy up and your appetite down. Everyone knows nothing is more satisfying than are. Like, what? Are you serious? And then this one really saddens me to no end. How about this one? Are you making your children pay for your weight problem? I mean, really trying to guilt trip you and say, oh, your kids deserve Coke. Coke is good for them. Don't make them pay for the fact that you're fat. I mean, it's disgusting. Honestly, disgusting. Now, what really made a big change in this, basically these scientists that the sugar industry paid off, they published this landmark research in the New England Journal of Medicine in the 60s saying fat's the problem. Let's all go low fat. Sugar's no big deal. And the thing that really started to turn all this around is the Framingham Heart Study. This is the longest study ever covering cardiovascular disease, also other things as well. It was started all the way back in 1948, but of course it just takes time. It took decades for all of the data to start coming in. And they started to see a completely opposite picture from what we were being told is healthy for us. Now I'm going to read you guys a direct quote from this study that was actually done by reputable scientists who were not being paid by anyone. They were doing this because they wanted to further the research, not because big sugar or big fat or some industry was paying them. So their quote is, the diet heart hypothesis that suggests that a high intake of fat is what causes heart disease has been repeatedly shown to be wrong. And yet, for complicated reasons of pride, profit, and prejudice, the hypothesis continues to be exploited by scientists, by fundraising enterprises, by food companies, and even governmental agencies. The public is being deceived by the greatest health scam of the century. I mean, that says it perfectly. You literally cannot say it any better than that. This is truly, in my opinion, the greatest health scam of the century. And that's why I'm here trying to undo some of that damage that we are now dealing with. Okay, so let's talk about the real contributors to cardiovascular disease. So number one, yes, excess consumption of vegetable oils, not great. So that's going to be things like canola oil. I don't know if you guys were like me, but my mom had basically a giant vat of canola oil that she put on absolutely everything. Yeah, fried foods are going to contribute. As I said before, that is about 25% of your cholesterol production. So don't think that just because I'm saying sugar is the main culprit that it's okay to douse your arteries in saturated fat every day. That's not true. It's still a piece of the puzzle. It's just not as big of a piece as we were led to believe. Number two, this is really the big one, the excess consumption of refined carbs, insulin resistance, all the reasons that we just discussed, how the sugar damages the blood vessels. That is the big one right there. Number three is actually nutritional deficiencies from a poor diet. We are getting very nutrient deficient in minerals and nutrients like magnesium, vitamin D, vitamin K. Our soil quality is getting worse and worse all the time. We are not rotating crops effectively. We are literally paying our farmers to farm not the best choices for us. It's crazy what we're doing to farmers these days. I mean, I come from a farming family and I feel their plight. They have to make a living. They're being pressured on every side to do the same crops year after year after year, usually high fructose corn syrup and soybeans. That's a whole other story. But yeah, our food is just not as nutritious as it used to be. And a lot of times our food is being harvested early before it has a chance to fully mature in the ground. And then it is being shipped and it's maturing on trucks. It's maturing like on the way. It's just not as nutritious. So even those of us who are making a distinct effort to get proper nutrition, we're still at a disadvantage compared to people 100 years ago, right? And I know that these first three things here are all about diet, but the role that diet and nutrition plays in cardiovascular disease cannot be overstated. And if you want to get down to the real problem and address it, this is where it starts. I can give you a blood pressure med that will lower your blood pressure temporarily, but if you continue to eat poorly and bathe yourself in stress hormones like cortisol all day, you will eventually need a higher dose. And then a few years after that, you're going to need another blood pressure agent. And then you're going to have to increase your dose again. And then you'll need a third. I mean, a lot of you know exactly what I'm talking about because you've already been dealing with it in your own life. These medications mask your symptoms. They do not address the true problem. Okay. Diet is a huge, huge part of the true problem. And even if your symptoms are getting better, like if you take a blood pressure med, your blood pressure is lowered, your symptoms are better, wonderful. That is super important and great. But the disease can still be progressing on some level if you are not addressing the root cause. Think of the boy in the boat, right? We could repair all the holes we want. If he's putting in new holes, doesn't really matter, right? Okay, number 4 is that we don't have adequate protection from viruses and bacteria associated with plaque. We now know that flossing and proper oral hygiene can help protect you against some cardiovascular disease. The same bacteria that lives in your gums when you have gum disease can actually travel to your heart itself and cause an infection within the heart. These plaques that build up in your arteries, they can also become infected with the same pathogens floating around in your bloodstream in the same way. They can make your disease progress further and faster. So it is important to keep your immune system up to snuff as much as you can and to limit your chance of bacterial exposure by taking good care of your gums and teeth. And then number 5 is inflammation. Inflammation really is the root of cardiovascular disease. The inflammation of the sugar scratching your artery walls, the pathogens that can infect your heart and cause inflammation, the stress response that keeps your body inflamed and full of cortisol. Guys, cholesterol is an anti-inflammatory. As I said, it is the tool that your body is using to address the inflammation. If you don't want your body to use that tool, then set yourself up to not have to, right? All right, so let's talk about the signs and symptoms of cardiovascular disease. So a heart attack, this is a blockage of blood flow to the heart muscle itself. It actually causes muscle death within the heart. It's excruciatingly painful. Anyone who has ever had to deal with muscle death, you know what I'm talking about. I don't know if you guys remember House, that TV show with the doctor who would limp around. That's what he had. He had muscle death in his leg, extremely painful, caused him all kinds of problems. That's kind of the same situation with a heart attack, but it's actually muscle death of your heart. Oftentimes, you'll see pain in the left arm or jaw, pressure on the chest, like an elephant is sitting on your chest. That's most commonly in men. In women, a lot of times we'll see some different signs like rib pain, nausea, feeling lightheaded or suddenly extremely tired, just exhausted out of nowhere, breaking out into a cold sweat. And unfortunately, we will see women misdiagnosed as not having a heart attack much more often than men. You know, sexism in medicine does certainly still occur, right? It's alive and well. So just so you know, if you're a woman, your symptoms might look a lot different when it comes to a heart attack. Now, heart failure, this is usually categorized by a shortness of breath, fatigue, swelling of the feet, ankles, legs, and abdomen. That is one of the big signs. If you guys are having unexplained swelling, please, 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 please see your doctor. Okay. It might not be a big deal. You might just be retaining water. It could be deadly serious. Okay. I can't tell you how many times I have seen this. So please, if you're getting swelling, get it checked out. Just make sure you're okay. Okay. There is also arrhythmia, which is fluttering feelings in the chest, palpitations. It can actually be due to a lot of different things. We do have some great medications that can help get that in track, and also surgical procedures that can get arrhythmia under control. And then there is stroke. Stroke is pretty similar to a heart attack. It is damage to the brain from an interruption in blood supply. Now, the vast majority of the time, this is going to be an ischemic stroke, which is basically caused by clots forming in the blood-brain vessels, blocking off that oxygen. Occasionally, we will see a hemorrhagic stroke. So this is the thing that your body is doing everything it can to prevent. It's a ruptured blood vessel. You are at risk of bleeding out, right? That is what your body is so paranoid about, and why it's like plastering your arteries with cholesterol. It is trying to prevent that at all costs. This can cause bleeding inside the brain, and a lot of times a stroke will look like sudden weakness, paralysis, not being able to communicate, and drooping, particularly drooping on one side. Since the brain is divided into hemispheres, if you see someone who's like suddenly drooping on one side, call 911. Do not hesitate. Okay. It's better to just have someone check it out and make sure they're okay, rather than to miss a stroke and have someone with permanent brain damage or even worse, death. Now, guys, the CDC, which is one of the most conservative agents out there, okay? This is not like I said, it's not a fringe theory. For some reason, this has not like hit mainstream consciousness yet. But the CDC estimates that 80% of cardiovascular events are completely preventable. That is what I want to drill into today. This is not inevitable. We do not even see heart disease in a lot of areas of the world where people live a different lifestyle than what we have here in the Western world. Okay. This is definitely something that you can prevent, something that you can get a hold of. This is not your destiny. Okay. I see so many people who come into my pharmacy who just are like, yeah, my dad died of a heart attack when he was 50. My grandpa died of a heart attack when he was 50. I know I don't have much time left. I'm like, no, 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 no. That's not true. Please, 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 take this seriously and do things to get your health back on track. Now, as far as risk factors for cardiovascular disease, diabetes, diabetes, diabetes. I cannot say it enough. The best way to prevent cardiovascular disease is to not get diabetes and to not get insulin resistance, high blood sugar, all of those things. High blood pressure, that is another risk factor. Like I said, if those vessels have that high speed and all of those particles are bouncing around off your arteries at a high speed, not good. It's going to have more risk of injury. Smoking is a risk for absolutely everything. But yes, heart disease included. Physical inactivity is another thing, okay? And it does not have to be super intense physical activity, you guys. Minor physical activity that gets the blood pumping a little bit every day, get the blood going from your feet up to your brain and your heart. This is vital to prevent cardiovascular disease. Alcoholism, this is absolutely a problem for cardiovascular disease. Alcohol is going to deplete your nutrients more than anything. It is going to get rid of these really protective, life-saving nutrients that are powerful antioxidants that help reduce inflammation throughout your body. Having gum disease, for the reasons that we talked about earlier, that little bacteria can travel straight from your gums into your heart. Not good. And then inflammation. Having chronic systemic inflammation throughout your body, obviously going to put you at a lot higher risk. Okay, so now let's talk about advanced cardiac labs. On the left here, you're going to see this article that was recently published in the Washington Post. This is what kills me about standard lipid panels, is they just do not tell us much of anything. Obviously, less than half of people who they're not catching most of the cases, right? Like we just saw earlier, 75% of people who have a heart attack had no idea because their lipid panels looked fine. Okay, these lipid panels are not that useful, but we do have advanced cardiac labs that give us a much better picture. For some reason, these are not standard operating procedure. I do not get it. I sincerely wish that advanced cardiac labs were the standard, that was just automatically improved by insurance. And they are in some places, like in the Cleveland Clinic, for example. If you have these like really important teaching hospitals, yeah, they're going to automatically order these for their patients. But for some reason, the vast majority of hospitals and doctors' offices just do not check these markers. They're just looking at the standard cholesterol, triglyceride, LDL, HDL. Total cholesterol just really doesn't tell us much. Total cholesterol could be elevated for all kinds of reasons, from Hashimoto's, from you had a recent infection, so your body ramped up production of your cholesterol because it's an anti-inflammatory, all kinds of reasons. It just really doesn't give us a good idea. Triglycerides, I call those the lie detectors because the only thing that really tells us is how much sugar you're eating. I love it because people will be like, yeah, doc, I'm following those directions really good. My diet's on track. And then I see their triglycerides and I'm like, nope, that's wrong. And then LDL and HDL, guys, these are not even actually cholesterol. Okay, I know we think, oh, LDL is the bad cholesterol, HDL is the good cholesterol. They aren't even cholesterol. The LDL and the HDL is the boat that carries the cholesterol around our bodies. The LDL carries cholesterol away from the liver and out to your arteries. That's why they call it the quote unquote bad cholesterol, but it's really just in transit to do a job. And the HDL carries cholesterol back to your liver for recycling. That's why they call it the good cholesterol, because it is taking the cholesterol out of your arteries back to your liver. But yeah, well, let's just get into exactly why those are not that accurate. So as far as this article goes, I just want to take another quote directly out of this article from the Washington Post, just to give you an idea of why the standard lipid panel doesn't make sense. Decades worth of research shows that measuring the number of ApoB particles in the blood predicts cardiovascular risk far more accurately than the standard lipid panel. But cholesterol guidelines barely even acknowledge its existence. I don't know why. I don't know why. It's hard not to be conspiratorial. You know, this class is like my most conspiratorial class because we've got big sugar pushing scientists to publish really whack job data. We've got wire insurance companies not covering these advanced cardiac labs that are so much better. I don't know. I can't begin to understand. I think that a lot of the motivation behind these choices is money. It's bottom lines. It's CEOs making decisions based on we don't want to pay for these procedures. We don't want to pay for this and that. We want to just, get our bottom line as high as we can. But who knows? That's all I'll say about that. Okay, guys. So heart risk is driven by the number and the type of cholesterol particles in the blood and not the cholesterol itself. That is the key thing that you're going to see here. Two people could have the exact same amount of cholesterol, but vastly different risk. Okay, it depends on if your cholesterol is all just kind of like one big fluffy particle that's floating around doing its great anti-inflammatory job, or if your cholesterol is divided up into like millions of little particles that get stuck in your arteries and cause problems. So let's go through each one directly and talk about it a little bit better. And also, I just want you guys to know that cholesterol usually elevates as we age. So if your cholesterol starts to get a little bit higher as you age, that's actually protective. That's not something to get too stressed out about. That's another thing that drives me crazy. A lot of times you'll see doctors who want to get someone's LDL under 70 and they're 70 years old. I'm like, why? Why? This is probably helping their brain health. It's probably preventing them from dementia. Like, what? You're not making any sense. Okay, so the first marker that I want to talk about is insulin. This is because insulin usually starts to become elevated about 5 years before your blood sugar becomes elevated. So this is your early warning sign. Before that blood sugar gets out of control, before the damage starts to happen, your body is already cranking out a bunch of extra insulin to protect you. So if we could see that warning system, instead of waiting until the blood sugar and the A1C is creeping up, that is wonderful. That means that we can address the risk before the damage actually happens. Okay, so I always, always, always want to pull a fasting insulin level on anyone to accurately assess. They might not be at any risk now, but this is showing they're going to be at risk 5 years from now, right? Let's bring it back, right? The next marker that I want to talk about is LPA, apolipoprotein A. This is basically your genetic risk factor for heart disease. And I say that because elevated levels are a completely independent risk factor for myocardial infarction, coronary artery disease, cerebrovascular disease, vein graft stenosis, retinal artery occlusion, like all of these. So even if all of your other numbers are completely not elevated at all, if this marker is elevated, you're still going to have increased risk. So that's kind of the interesting thing about it, is that it's completely independent of all the other risk factors. All the other ones kind of work together, not this one. This one is its own thing, if that makes sense. And okay, let's see here. So the thing about the LPA, I put it on this panel as well, because even though the heredity plays such a large part in whether or not this is elevated, that's just literally your genes, you can actually still bring it down with niacin. We have lots of clinical trials showing that niacin can bring down your risk of heart disease with your LPA. So I've seen some people who start taking niacin who even get within normal range. A lot of times you can't quite get to normal range, but you can at least bring it down to almost normal range. And if your LPA is elevated, then you know you got to watch yourself. You're not one of these people who could just go crazy with your diet, do whatever. For the rest of your life, you kind of need to take a little bit better care of yourself, because you do have that inherent genetic risk more so than most people. This measure, I also like pulling it because many, many times, I will say most often, LPA is not elevated. I cannot tell you how many patients have said, my dad, my granddad, my uncles, everybody died of a heart attack or a stroke. I know that I'm doomed. There's nothing I can do about it. Da, da, da. We pull an LPA, it's not even elevated. They literally have zero genetic risk, and that is so exciting to tell someone this is not your fate. Okay. You have zero genetic risk. All right. You just need to take care of your body properly. Probably what was passed on in your family was bad eating habits, or, stressed out environment, or maybe generational trauma. Something like that was passed down rather than your genes. Your genes are perfectly fine. So that can be really soothing to people, right? All right, the next marker I want to talk about is ApoB. This is the most important marker. And the cool thing about ApoB is a lot of times your insurance will cover this at no charge to you. So guys, write this down, ApoB. The next time that your doctor sends you in for blood work, tell them to order ApoB. You can get this for free. 9 times out of 10, insurance will cover this with a standard lipid panel. Doctors just aren't ordering it. I don't know why. There's no explanation for it. But if you remind them, most of the time, they will go ahead and add it on to your standard lipid panel. And this is the article right there from the Washington Post. That's all talking about ApoB. This is like the best way that you can determine your risk. So ApoB is a protein produced in both the liver and the intestine that actually provides structure to the triglyceride carrying the lipoprotein particles. It is a direct measure of the atherosclerotic particles in the bloodstream. It's basically a direct measure of the bad stuff floating in your arteries. It's as close as we could get as to like, that's it. Check that. If you can't do anything else, check that. And like I said, even those of you who have limited income, your insurance should cover this. So please push your doctors to get this. And as far as ApoB go, we like to see a number less than 80. All right. If you're getting above 80, that is when we know that you are at risk. That's when we know things are not going the way that we want. All right, the next marker that I want to talk about is LDLP. So this is the number of actual LDL particles in the blood. So let me try to explain.
No fucking way.
Oh, sorry, guys. I don't know what just happened there. Sorry, that was very entertaining. Okay, so LDLP is the number of actual particles in the blood. Let me try to explain this as clearly as I can. Sometimes this can be a little bit hard to understand, but basically, okay, two people could both have an LDL of 150, right? And that's elevated. We always like to see less than 100 ideally, but let's say two people both have an LDL of 150. One of those people could be at great risk and the other person could be at no risk whatsoever. This is because a measurement, an amount of the total LDL is just not specific enough. The LDLP is the actual number of particles. So think of it this way. If the LDL is 150, let's say that's 150 people. And what we are trying to do is prevent a traffic jam, right? That's basically what a blocked artery is a traffic jam. So if we take those 150 people and give them each their own car and try to put them through a bottleneck, we have a traffic jam. Now let's take all 150 of those people and put them on a Greyhound bus. there is no traffic jam. So that is what your LDLP is. It is a measure of the number of actual particles that are blocking up the artery. So you can have a pretty high LDL and not even be at any type of increased risk. So I just think that this number is really interesting. And we have data from multiple epidemiological studies that have demonstrated that LDLP better predicts cardiovascular events than your standard LDL-C that is on your standard lipid panel, particularly in patients where the two disagree. So if someone has a high LDLP and a low LDL standard, the LDLP is right. Same thing the other way. If someone has like an elevated LDL, but their LDLP is low, the LDLP is right. So, you know, something to keep in mind there. And as far as LDLP goes, we want less than 900. Less than 900 is key. But I will say that really healthy people with great lipid profiles have less than 500. So something to keep in mind there. All right, the next marker I want to talk about is small dense LDL-C. These are the super, super bad guys. When these are elevated, your risk of cardiovascular disease increases by 200 to 300%. So small dense LDL is one of the more specific risk factors enhancing the predictive power of cardiovascular disease in individuals. Lipoproteins transport cholesterol throughout the body, but it's the actual lipoprotein particle and not the cholesterol within them that penetrates the arterial wall. So the thing about small dense LDL is that they are super, super, super small. Why is this small size so incredibly harmful? Because these smaller particles penetrate that arterial wall really easily. If you've got a big, large, fluffy LDL particle, it's just kind of like bouncing off the walls and it's nice and smooth. Like I said, it's anti-inflammatory. It's not like sugar, so it's not really doing much. If you got these little tiny LDL particles, a bunch of them, they could get stuck in that arterial wall like that. Okay. The smaller the LDL particle, the more likely it is to enter the arterial endothelium where it can become oxidized. It's taken up by macrophage cells. Then it becomes a foam cell, which eventually those stick together to build plaque within the arteries. Evidence suggests that small dense LDL is also associated with vascular dementia. So this is not just bad for your heart and your veins and your arteries, also terrible for your brain. So I like to get a small dense LDL when I can. Okay, another marker is your hsCRP. This is basically a protein that is produced in the liver in response to systemic inflammation. Oh, hold on. There we go. So it measures inflammation in the body, and cardiovascular disease is a disease of inflammation. Now, hsCRP is not specific to cardiovascular disease. Sometimes we will see it elevated and it's due to some other inflammation throughout the body. But I like to pull this measure because when this is elevated and your other levels are elevated, that is of great concern. If your hsCRP is not very elevated, then the other markers are less important because you don't have the inflammation piece of the puzzle, right? And I'm going to really drive this point home. Cardiovascular disease is about inflammation, okay? So if you don't have markers of inflammation, great. Your risk is going to be much lower. And we want to see your hsCRP to be less than 2. Okay, the next marker, I call it your LP play 2. The actual name is your lipoprotein associated phospholipase A2. So you can see why I call it your LP play 2. This is an enzyme that is elevated when macrophages in the tissues are breaking down phospholipids. So this marker is associated with unstable, actively growing plaques that are much more likely to break off and cause a heart attack or a stroke. So of course we don't want to see this elevated, and the number we're looking for here is less than 180. And another marker that I like to pull for some people is MPO. This is myeloperoxidase. So patients who have like known coronary artery disease, people who have active chest pain, people who have other risk factors, they can benefit from getting this level checked. This is an enzyme made by white blood cells in the artery wall, and elevated levels of this MPO enzyme indicate a presence of unstable plaque buildup in the artery wall that is at high risk of a cardiovascular event within 1 to 6 months. When this is elevated, I send someone directly to the doctor. I'm like, do not pass go, do not collect $200. You may not make it back out to your car. Okay. Like within 1 to 6 months, you're having a heart attack or a stroke. You need to get this under control yesterday. Okay. So I like to pull NPO for my high risk patients just because that can really, really be beneficial for those people. For most people, probably not as big of a deal. You're probably not at risk of a heart disease or stroke within the next 6 months. But if you've got other things going on, this might be worth getting. Your NPO, we want it to be less than 400. Okay, so guys, as far as getting these lipid panels done for yourself, as I said, talk to your doctor. Talk to your doctor. They can absolutely at least get your ApoB. Now, as far as the other markers, they are not very likely to be covered by insurance, but your doctor might still be willing to write these panels for you and potentially save you some money, right? Generally, if your doctor does it, it's going to be cheaper. Now, I do offer these for you guys, for those of you who, you know, cannot get your doctor to order it, which I see, unfortunately. I have this. I will tell you how to get it at the end of the thing here, but I have like a heart panel light. And this is basically $156 once everything is added together. It's got your ApoB, your most important marker, your LPA, that's your genetic risk factor, your HSCRP, all about the inflammation, your insulin, so we can get an early warning, your LP-Play2, and the small dense LDL. So it's got a pretty good picture of exactly what's going on. And then if you are at risk, if you've got more things going on, I also have the full heart panel, which includes all the things in the light heart panel, but then also has your LDLP, which is like the bus versus the cars, and your NPO, which is your risk of having a heart attack or stroke within the next 6 months. So that one, I think the last time I checked, it was $235. And guys, I don't make any money off of these labs whatsoever. So I'm literally just doing this to try and help you guys get these numbers if your doctor is not willing to work with you to get these numbers. But like I said, I'll tell you at the end how you can do that if that's something that you're interested in. Okay, so now let's talk about the treatment and the prevention of cardiovascular disease. Number 1, diabetes. Avoid diabetes. Keep those blood glucose levels in a normal range. This will prevent sugar crystals from damaging your blood vessels in the first place. And you guys, just last month, we talked about this quite a bit, how you can help prevent sugar issues, diabetes, and all that. Walk for 2 minutes every single time you eat. Every time you put food in your mouth, as soon as you are done eating, just walk. Or if you can't walk, move your arms, do whatever, any type of motion whatsoever. This will drastically regulate your blood glucose levels. It is absolutely free. It is easy. You can give me 2 minutes, okay? I'm not asking you to take an hour out of your day and go do something intense that's going to be painful. 2 minutes, you guys, please, please. This can be life-changing for you, okay? Also, eat protein with every meal and snack. That is key. The key is no unaccompanied carbs. Okay. And when we drop in carbs all by themselves, they flood our system with sugar, even if they're relatively decent carbs. If you combine that carb with protein, it gets released much slower. You're not going to have the blood sugar spike. You're not going to have the insulin troubles. You're going to stop all of this before it even becomes a problem. So another thing that can really help as well is to not snack. If you can keep your insulin levels down a little bit so that you don't develop insulin resistance, that is so good for you. Try to avoid snacking. Try to space out your meals by every 4 hours. This is not just, now some people can't do that. If you've got hypoglycemia, ignore this advice. But for those of us who don't have hypoglycemia, this is one of the best life hacks that you can do. Okay, it's going to help with your digestion. It's going to help if you've got any type of SIBO, SIFO, anything like that. And yes, it is going to help prevent insulin resistance. Another thing that you can consider if you want to go all in is intermittent fasting. This just gives your body more time to allow insulin and glucose levels to fall, which will avoid insulin resistance in the long term. That one's a little more intense, but the first 3, every single one of you can do them. So I want you to make a commitment today that you're going to walk for 2 minutes every single time you stop eating, that you are going to combine your protein with your carbs, and that you're going to try to avoid snacking as much as possible. You got this, okay? All right, so the number 2 thing that you can do to prevent and minimize your risk of cardiovascular disease is to minimize cortisol and stress. So cortisol disrupts normal insulin activity. This is going to start that whole bad cascade. It also elevates blood pressure. And as we talked about, the faster the sugar crystals are moving, the more likely they are to scratch up your blood vessels. Cortisol also contributes to insomnia and bad choices. One of my biggest problems with insomnia for me personally is that if I don't get a good night's sleep, the entire next day I'm like, oh, poor me, I need a candy bar. Oh, poor me, I'm going through so much. I just make bad decisions, right? And I think a lot of us are the same way. So try to curb that, try to get proper rest, minimize your cortisol so that you don't have the insomnia. Now, things that you could do to minimize your cortisol and stress are vagal tone exercises. This is basically anything that reverberates or vibrates in your throat. That's where your vagus nerve kind of travels down. And your vagus nerve, it activates your parasympathetic system. So your sympathetic system, that is basically your stress response. That's what gets your heart going. That's what makes you sweat. That's what makes you more alert, right? And then that's supposed to be a short-term situation. Your body is then supposed to come down from that by activating the parasympathetic system. It does this with the vagus nerve. Now, we can strengthen our vagus nerve. We can make it more capable of calming us down quicker by doing things that vibrate it. This is singing. This is humming. This is chanting. That's why you see the people doing the they're literally trying to activate their vagus nerve. So to me, that's silly. But now singing in my car, I could get on board with that. So I try to sing every time I get in my car. And, I'm like, hey, I'm doing myself a favor. I'm helping my health, right? Also, spending time outside in nature. We have multiple clinical trials showing us that literally just going outside for 5 minutes every day is going to decrease cortisol levels. All right. So that is really something that's important to prioritize as much as you can. This time of year, it's rough. Try to do it if you can. And also, guys, anything that relaxes you, honestly, try to do more of what you love and less of what you hate. Guys, I get it. I get the pressure of the world that we live in. I completely understand that it feels like you have no time. You're stressed out. You've got so many things on your plate. But if you could take 5 minutes a day to do something that makes you happy, gets that dopamine going and brings you joy, that is going to decrease your cortisol long term. And that's the thing, you guys, I talk about it all the time. That true health comes from making lifelong commitments to small changes. Okay, I'm not ever going to do one of these like, okay, guys, let's do a 30-day fast. Let's do a 21-day fix. Da, 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 da. No, that's just not beneficial. In fact, it hurts you long term. What makes a big difference in your life is dedicating yourself to a small change that is easy to maintain. And this is a great example of that. Just try to do a little self-care every day. There's also CBT, cognitive behavioral therapy. If you're going through a really hard time in your life, that is certainly something worth looking into. And yes, there are supplements like pharmagaba, ashwagandha, things like that that can also help to decrease your stress response and help with your cortisol levels. Okay, the next thing that you could do is maintain a reasonable weight. I'm not going to beat a dead horse. You guys are here on a Sunday afternoon. Obviously, your health is a big priority to you. So you already know that this is a thing, right? Most of you dealing with weight problems, it's probably not your fault. You probably got other stuff going on that's really causing the problem, and it's not you. So we won't really go into that. Okay, number 4, increase your healthy fats and fiber. Okay, guys, we have so much research showing that a diet that is high in omega-3 and fiber is proven to keep cholesterol in check. And the omega-3 and the fiber, the good fats and the fiber, they attack both sides of the cholesterol picture. The fiber is going to decrease your absorption of cholesterol from your diet. So if you're going to eat a big juicy steak full of saturated fat, add in some veggies. Okay, that is actually going to decrease how much saturated fat that you get, right? And then the other piece of the puzzle, the inflammation, the sugar, the omega-3 is a potent anti-inflammatory that is going to knock out that piece of the cholesterol picture. So the combination of healthy fats and fiber, it is a winning combination, absolutely. So what can you do? Swap out your canola oil for avocado and olive oil. Avocado oil and olive oil are very healthy fats full of omega-3s. Olive oil is best used cold. use it as a salad dressing, use it to just sprinkle on things afterwards. I know people who actually take their supplements with just like a little spoonful of olive oil, which I love. You know, that's really going to help increase your vitamin D absorption. Avocado has a much higher heat point. So if you're going to be baking something, cooking something on a skillet, whatever, that's when you want to use avocado if possible. Now, I know that avocado is much more expensive than your standard olive oil, canola oil, all that. So it might be out of the budget for some, but for those who can afford it, avocado oil is a wonderful way to get a nice, healthy fat into your diet. You can also consider an omega-3 supplement. I actually think that this is a good idea for most people. It's just hard to get enough omega-3 from diet alone. It's possible. If you are really on point with it, you can absolutely do it. But for a lot of us, it's really difficult. For me, I can't do it. So that's why I say omega-3 supplements are usually good. Now, omega-3 supplements do interact with blood thinners. So always check in with your doctor before you start any supplement just to make sure that it's safe for you. Okay. Another thing you can do to increase your healthy fats and fiber is to get in plenty of fruits and veggies. We want to aim for 25 grams of fiber daily for women, 35 grams of fiber daily for men. And guys, let me tell you, that is the bare minimum. Okay. When we look at gatherer communities, which are usually some of the most healthy communities in the world, they're averaging about 100 grams of fiber per day. That is crazy. When you consider that we're like, can you get in 25? And people are like, I don't think I can do 25. You know, hunter-gatherers are out here with 100 grams per day. So try to get in that fiber as much as you can. The best way to do it is fruits and veggies. Whole grains work as well. All right. So what is something else you can do to lower your risk? Eat the rainbow. So earlier we talked about how nutrient deficiencies can be a big part of the problem. Well, if you eat the rainbow, you could severely curb that problem. Eating the rainbow reduces inflammation, and this is a disease of inflammation. These antioxidants, these polyphenols, all of these wonderful little things are potent anti-inflammatories. Like I said, decrease your risk of mineral and vitamin deficiencies. Magnesium in particular, super, super helpful for blood pressure, super helpful for everything. And the problem with magnesium is that almost every modern pill depletes your magnesium. So if you're taking a prescription medication, you're probably depleted in magnesium. Not all of them, but a lot of them, okay? Everything from your diabetic medications to your blood pressure medications to your birth control, like everything under the sun is going to deplete your magnesium. So if you are taking a prescription med, you probably want to take magnesium or make sure that you are getting plenty of magnesium from your diet. Eating the rainbow is also going to help your body repair and protect your body from free radical damage. And I always say, try to get in one red, one blue, one yellow, and one green food daily if possible. Okay. Sometimes that can be challenging. I'm going to openly admit I am not able to eat the rainbow every single day. But if you are eating the rainbow more days than not, you are absolutely on a great track. Okay. All right.
I know. That might have been scary for some. Oh, I didn't do the mouth. That makes it scarier.
Not muted. Okay, there we go. I think we got him. All right. Sorry, guys. We got a few interruptions here. Okay, so as far as supplementation goes, according to a research paper published in JAMA, July 19th, 2023, this is so scary for me as a pharmacist. They tested supplements just like off the drugstore shelves, and 89% of the supplements that they tested did not accurately label the ingredients. Most of them were just in the wrong amount. So you're buying a magnesium 400, but it only has 200 in it, right? But some of them did not even contain the main ingredient. So sometimes they would test the magnesium and there's no magnesium in it whatsoever. I mean, that's crazy to me. So this is why I am so big on third-party testing. Now, some third-party testing sites that you can access to see if your favorite brand is covered there is labdoor.com. Labdoor.com is absolutely free. Okay, that's a free resource for you. Now, Consumer Labs is another resource. That one you do have to pay for. So, you know, I'm not a big fan of paying for things if I can help it. And this is why I have now become completely obsessed with Designs for Health. You guys follow me on social media. You know, I talk about them all the time because they are all third-party tested. Every single supplement they have is third-party tested for purity, for accuracy of ingredients, for all of the good stuff. They are actually in clinical trials. They use the proper strains of their probiotics, of whatnot. They use all of these super bioavailable forms. So it just saves me a lot of time as a pharmacist. When I know that I'm recommending a Designs from Health supplement, I know that it actually has the right thing in there. Okay. So as far as supplements specifically for cardiovascular disease, number one has got to be omega-3. Absolutely. A meta-analysis showed that omega-3 supplementation reduced serum triglycerides and raised HDL. And also in patients with sorry, guys. Whew, this is a long class. In patients who have high cholesterol, taking a statin, adding omega-3s significantly reduced the incidence of major cardiovascular events. This suggests cardioprotective effects of omega-3s. We've got lots of clinical trials showing that a diet high in omega-3s and that omega-3s themselves are super cardioprotective. Now, when it comes to Designs from Health, they have a lot of varieties, so I just kind of want to briefly go over why you might pick one over another. Their most popular one is the Omega Vale Hypo. The Omega Vale Hypo, it's 1,600 milligrams with a 1-to-1 ratio of EPA to DHA. Now, DHA is what is best for your brain health. So if you have things going on, like if you have concerns about future dementia, if you've got brain fog, if you feel like you need more support there, you're going to want to make sure that you get plenty of DHA in your omega-3. The EPA is what is best for your heart health. So when you get the Omega Vale Hypo, it's a 1-to-1 ratio. And then the 1-to-1 ratio appears to be best for your liver. So this is like the supplement that's overall good for everyone, right? It's good for people who are worried about their heart, their brain, their liver. It covers all the bases. They have another version of omega-3. This is the Omega Vale TG1000. This is their most potent EPA. This one is specifically for people with cardiovascular risk or disease. It's got more of the EPA in it. So yeah, they still have some of the beneficial brain and liver stuff, but it's really, really jacking up the quantity of the heart health stuff. It's specifically for cardiac health. And I will say, like, I've actually switched back and forth between the two because one time they were out of the Omega Vale Hypo, so I went ahead and ordered the TG1000. I mean, you know, it's not the end of the world. Either one of them is good, but that's just kind of a little bit of a differentiation there. And the cool thing about these supplements from Designs for Health is that they are in the triglyceride form. So this is much easier for your body to absorb. If you are taking omega-3s, I want you to take a look and see the form that it's in. If it is in the triglyceride form, good for you. You got a good one, stick with it. If it is in the synthetic ethyl ester form, let me say that again, since it's hard to understand me with my synthetic ethyl ester form is just not as good. That form, it's more convenient to produce, it's cheaper, but it is not readily recognized, digested, and assimilated by the body. Another problem with it is that it is prone to oxidation and production of free radicals. So basically that just takes away all of the good benefit. If you're trying to take this as an anti-inflammatory so your body can use it to get rid of free radicals, but it has oxidized and it now has free radicals, there's no point in taking it. So I highly, highly suggest that if you supplement with omega-3, you get the triglyceride form. Please skip the ethyl ester form. It's just not as good. And Designs for Health also has versions that are for kids or people who don't like the pills. They've got liquid and they've got smoothies. I give my kids the smoothies. I just kind of think that's a little interesting side note. Okay, another supplement that you can think about is niacin. This is a form of B3. Niacin supports healthy lipid levels without the side effects of statins, and it's also super helpful for vasodilation. This is relaxation of your blood vessels, so it can assist with blood pressure. That's what most people take niacin for, is blood pressure, but it will also help your lipid levels. And the niacin from Designs for Health is a slow release formula to minimize flushing. But I will say those who are very sensitive, sometimes I still see them get flushing with it. So, you know, kind of depends on if you're a really sensitive person to medications or not. The niacin is best taken at dinner food. because your cholesterol is made at night. So the niacin, that's going to be the most beneficial time that you can take that. And as I said earlier, the niacin, the cool thing about it is that it can bring down your LPA. So if you have that genetic risk, this is basically the only way you can really bring it down is through niacin. Another supplement that can help with cardiovascular disease is plant sterols. These help reduce the absorption of cholesterol in the gut. So these are going to work on that 25% part. So if you're someone who loves your steak and you're not going to be giving up your saturated fat anytime soon, this is for you, right? If you don't eat a lot of fat in your diet, there's really no point in plant sterols. But if you're a steak and potatoes kind of guy or gal, this is for you. Take this when you eat a meal that has fat. It is going to decrease your absorption of the saturated fat. And as I said, vegetables will also help with this too. So anytime that you are eating something with saturated fat, add in those veggies, add in those plant sterols. Okay, another really interesting one is Ina. This actually enhances insulin secretion and it lowers blood sugar levels and reduces cravings for sweets by making them taste not quite as good. It kind of suppresses the sweet taste. So that's really interesting. And I love the product from Designs for Health, Glucose Supreme Herbal. It's got the gymnema. It also has berberine, which I'm sure you guys know all about berberine, fenugreek, ginseng, cinnamon. They literally just took all of the really good sugar balancing supplements and put it into one pill. That's what I love about it. It just really decreases your pill burden, right? And the best way to take the Gluco Herbal Supreme is with 2 with breakfast and 2 with dinner. And then turmeric, guys. Ooh, I love my turmeric. It's a really potent anti-inflammatory, and it contributes to increased LDL uptake through activation of the expression of LDL receptors. In fact, in one trial, supplementation for 9 months led to decreased insulin resistance in diabetic patients. In another trial, it led to decreased LDL and decreased small dense LDL. In another trial, supplementation with turmeric lowered A1C and fasting glucose after just 3 months. Turmeric or curcumin, it is just amazing. I absolutely love this stuff. And this is one rare case where it is better to get this from a supplement than from diet. 99% of the time, I say get things from diet whenever possible. Turmeric is the exception. It is just not very bioavailable. It's still great to get from your diet, add it to your food whenever you want, because it also improves your digestion and your stomach. So it can help that. But as far as when it comes to like lipid lowering, A1C lowering, all of that stuff, there's just not enough of it in the food to actually make an impact. It's not bioavailable. You need to get something that is specially formulated to take the extract out of the food itself. And we just see it provides superior benefit. The supplementation does in clinical trials. The food just doesn't really get the job done. And the last one I want to talk about is red yeast rice. This product is going to help to reduce cholesterol synthesis by suppressing the making of more cholesterol. It basically works along the exact same pathway as a statin. It's just more subtle than statin. So you're going to be less likely to experience the muscle pain, but it is still possible. Okay. I just want to be clear with that because every once in a while, I will see someone who starts the red yeast rice and they start to get the muscle pain. It's like statin light. That's what RYR is, statin light. And the thing I like about RYR Synergy, which is the product from Designs for Health, is that it has a potent CoQ10 with it. So if you take red yeast rice, please, please, please take CoQ10. If you don't get a combination product that has both, then purchase them separately. But I'm telling you, it will deplete your CoQ10. It is literally a statin light. Okay, so make sure you're getting that CoQ10. Sorry, guys, I'm trying to hold it together here through the end of the thing. Okay, now let's talk about medications that you could take in order to help with your cardiovascular issues. First of all, I just want to be on the record as a pharmacist saying statins are not evil, okay? Sometimes they are required. Like we talked about earlier, if you have severe artery blockage, it is an emergency. You need a statin. Nothing is going to get rid of your cholesterol quicker than a statin, period, end of story. Okay, now if you're wanting to avoid a statin, then that's on the prevention side. That's before you have major issues. And guys, sometimes you can bring your cholesterol down with a statin and then get off of the statin and do the things in order to make sure that you don't have to go back on it. Like a statin is not a lifetime sentence. Okay. Sometimes I see people who are just so desperate to never take a statin. I'm like, hey, sometimes it's necessary. All right. I understand wanting to avoid them. Yes, they do come with a host of side effects. Absolutely. I get it. But don't be so terrified of statins that you have, drawn a line in the sand. You will never, ever do it under any circumstances. Now, as far as statins go, some are certainly better than others. Hydrophilic statins basically means that the drug is not going to accumulate as much in the places that we don't want it. So like fat and muscle tissues, it's more going to stay right in the liver. And that would sound ideal, right? And as far as hydrophilic statins, we have rosuvastatin or Crestor and then pravastatin. Okay, so in theory, these are more likely to work only in the liver. But I will say that in clinical trials, we don't really see much of a benefit with the hydrophilic over the lipophilic. So you would think that rosuvastatin and pravastatin would have a big advantage. In the trials, it just doesn't really pan out that way. They all seem fairly similar. But, if you want to go for hydrophilic just to try and do that extra step to prevent side effects, go for it. Rosuvastatin would be the #1 choice. Atorvastatin is also good. It's lipophilic, but it is not very likely to interfere with meds. Some of the other statins, they just interfere with a bunch of medications. It starts to make your profile really complicated. So that's one of the advantages of atorvastatin. I will say the worst statin is simvastatin. If you can avoid simvastatin, you probably should. We just have much better options out there. Simvastatin 80 in particular, that's the highest dose. We see crazy amounts of muscle pain, and the simvastatin 80 in clinical trials does not perform any better than the low dose simvastatin. I do not understand why it's on the market. It should be pulled off of the market. It makes no sense. Why on earth would we keep a genre of drug around that has no benefit and has increased risk? Someone make it make sense. Okay. So if you're on simvastatin 80, you may want to have a chat with your doctor. Now, as far as myopathy goes, or that muscle pain that could come along with statins, it is reported in 1 to 2 out of every 100 patients. So for every 1,000 people who take statins, they will prevent 18 people from having a major cardiovascular event. So that's just to give you some numbers of what you're working with here. And when it comes to statin, CoQ10, CoQ10, CoQ10. Okay, do not skip your CoQ10. Statins will absolutely deplete your CoQ10 to catastrophic levels. You can help a lot of this by adding it back in. And also, you guys, when it comes to statins, you can talk to your doctor about decreased dosing. So if you've got muscle pain or if you're afraid of that, ask them about taking it every other day or every third day. Okay, we could do things to work around statin medications to make them possible for you if you need them. Now, as far as blood pressure medications, these are proven to extend life. ACEs and ARBs, these are the first line for great reason. They work by lowering the effects of angiotensin II in the body. And angiotensin II, it's a hormone made by the body to balance blood pressure. So when your blood pressure drops, the body will make angiotensin II to bring it up. Angiotensin II will narrow your blood vessels, especially in the kidneys. And when there is too much of the angiotensin II in your blood vessels, your kidneys lose the ability to relax. This causes high blood pressure and kidney damage. So now hopefully you guys can kind of get an idea of why ACEs and ARBs are often prescribed to help prevent kidney damage. So if you've got high blood pressure, ACEs and ARBs are absolutely the way to go unless you have bad side effects with them. I love my ACEs and ARBs. That's like your lisinopril as far as an ACE, and ARB would be like losartan. Really, really good medications. And the angiotensin II, it can get high due to lots of different things. It could be because you got PCOS, you've got kidney disease, heart failure, overactive adrenal glands, dehydration, sometimes even a lack of salt. Believe it or not, I've seen it just be electrolyte imbalance. So lots of reasons why that whole process can kind of start to spin out of control. And the ACE and ARB can kind of help bring it back. And then there are also beta blockers, which block the effects of stress hormone on the heart. Beta blockers are so interesting. I hope that a lot of you come to the class in 2 weeks. That's going to be all about stress and anxiety. We're going to talk a lot more about beta blockers because they're also super beneficial for stress and anxiety. Okay, so now to the goodies. Thank you so much for sticking around this whole time. I'm sorry that I sound so crazy and I keep coughing, but we made it. So if you want to go to www.regenesisrx.com, click under the education tab, you are going to get a free ebook there all about natural ways to lower cholesterol. You can also watch the replay here if you want to share it with any friends or family members. Go for it. The replay will probably be up like later tonight, maybe tomorrow. It depends on how long it takes Zoom to like load it. And then you could also access those advanced cardiac labs. If you cannot get your doctor to order those for you, or if you just want to, circumvent the whole process and order them directly yourself, it gives you that option right there. And then once you order those labs, you can book a one-on-one appointment with me to go over this. Would not be more than half an hour. A half an hour visit. If you're an app subscriber, it's $125. If you're not an app subscriber, it's $150. But I would go over these with you in great detail, explain exactly what your risk profile is, the steps that you can take, all of these things, right? So those are some options there for you. Okay, so if you're not a part of the app, if you don't subscribe, I highly, highly suggest that you do, you guys. We're having a lot of fun with these webinars, with these classes, with these ebooks, but I drop all kinds of stuff in there all the time. You're going to get recipes every month. You're going to get monthly challenges. Ebooks drop in literally every 10 days. You're going to get meal plans. And also another huge benefit is you have direct one-on-one text messaging with me. So if you've got a question in the middle of the night and you are like, I don't know what's going on, you can literally text me right there in the app. And it's a one-person team. You're not going to get a hold of someone else who doesn't know what they're talking about. It's just me. So I will text you right back. I text everyone back in the app within 24 hours. So, it's kind of just a big advantage to help clarify things if you got any quick questions, anything like that. So you can do that. And then also, regenesisrx.com. You can sign up to join my practice if you'd like. A lot of you have already done so, and it's been really rewarding. That's all I can say. I really appreciate you guys and everything that you have done to kind of make this a reality. Now let me pull up my chat here because now it's time for Q&A. Oh, we got a lot of chats here. All right, let's see. Oh, hi, Ricky. So good to see you. Hello, everyone. Awesome. Oh, I sound fine. Good. Thank you. Sorry, guys. The chat was completely a problem. Are you near Florida? Yes, I am in Florida, actually. I love Florida. Okay. What would you investigate to determine why mom, 86 years old, causes her heart rate to increase to 190 to 203 beats per minute during mild treadmill exercises? Ooh, okay, JD. Yeah, that is really high. We don't want to see that. So is this specifically with treadmill, or is it any time that she tries to do any type of activity whatsoever? If she is having her heart rate jump up that high, I would say avoid treadmill exercises. Try to do something even less intense if possible. And definitely talk with her doctor. Make sure that her medication regimen is on point. We should not see that type of fluctuation with really mild exercise. That sounds like it could be a sign of a bigger problem. I don't see a pic. Yeah, sorry guys. I know. I would show you myself. I'm not that ashamed. I'm really swollen and ugly, but who cares? I just didn't want it to be distracting. Human nature is such that people are going to want to see like, whoa, you look like the swamp monster. Okay, what tests or diagnosis can be done to determine if you have any blockage in your arteries? Okay, so yes, just the things that we talked about earlier. There's not really like blood testing you can do to say, oh, you have a blockage right now, but the blood testing can determine you are at very high risk of a blockage within the next 6 months. So it's a very accurate picture. If you're actually trying to see a direct blockage, that's more going to be a medical procedure within the hospital where they can, do all of that stuff with the stents and whatnot. What tests or blood work should be completed to determine if you have insulin resistance? So number one is going to be insulin. Just directly testing the insulin. That's going to show, and then if you have elevated blood sugars, you've got insulin resistance, because basically that means your body has pulled on that lever of insulin so much that it's no longer working. That's like the definition of insulin resistance. Why isn't there a class action lawsuit against sugar producers? Seriously, I agree completely. Or a class action not against sugar producers, but drinks and candy and cereal. Yes, that's exactly. I think that that is the biggest. I know that Coca-Cola was the biggest contributor to that whole sugar thing that we talked about earlier, but there were several other companies involved as well. It just kind of escapes my memory at the time. But if you look up that NPR article, it gives you great, great detail about all of that. Super, super interesting. Very depressing, I will say, but super interesting. Diet and exercise, more physical activity, and better sleep help so much. Yes, 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 Ricky, you are so right. I think because who is sugar products, it's an American systemic issue. Somehow we've let legislator let it be okay to sell us high fruit. Yes, you are so right. Absolutely. And we're literally, it's crazy because we pay our farmers to poison us. Our farmers would love nothing more than to produce organic, healthy, delicious, nutritious food. But if they do that, they lose money, right? You can't do that. Like farming is already such a difficult industry in this country. And then when we financially pressure them in such a way that they're only going to be able to access enough money to keep the farm going if they produce these overabundance of corn and soybeans, I mean, they got to do what they got to do. You know what I mean? Everyone's got to make a living. They got to take care of themselves. So it's sad that we have literally, as a country, decided to pay our farmers to poison us. It's wild. Real science hardly ever affects regulations. Unfortunately, you're right. You can have pain in your right arm during a heart attack too. This is true. And your neck. Absolutely. How do you reverse insulin resistance? You got to bring down your insulin. That's the biggest thing. The steps I told you about earlier, the walking for 2 minutes after eating, combining your carbs with protein, basically getting the blood sugar out. Get the sugar out of your blood. Okay. Then the insulin is going to start to drop as well. Spacing out your meals, having periods of time where your body is not constantly releasing insulin, all of those things. It may be different in other countries, but in the US, it all comes down to money. Absolutely. Will there be a transcript of this Zoom call? Ooh, I don't know how to do that, Ricky. I'll have to look into that. I mean, I'm going to have a replay, but I don't know about a transcript. Do clinics or providers get charged more from Medicaid? Clinics and providers make less money off of Medicaid. What is your definition of a normal range? Intermittent fasting does eventually remove the day-long food craving. It trains your body to expect food during a smaller time window. Absolutely. What type of magnesium? Magnesium glycinate is the best overall. It's really well absorbed. If you have a severe problem with blood pressure, you may also want to look into magnesium taurate or a combination of the two. Magnesium taurate can really bring down that blood pressure. Is it the sugar and fructose bad for you? That's why fibrous, yes. Yeah, exactly. So when sugar comes in fruit form, it is combined with fiber. It's combined with phytonutrients. It does not get released as quickly into the bloodstream. Okay, you still want to combine it with protein, combine it with fat so it releases even slower. But no, the sugar that is in fruit is not harmful. Okay, I want to be abundantly clear about that. It is just not the same vein as processed sugar. Have you heard of a product called Field of Greens? I have not. I'll have to look into that one. Just to make sure I heard correctly, the ApoB blood workup should be, yes, correct. Niacin is also good for the lungs. Absolutely. Niacin induces the release of vasodilating prostaglandins for which receptors are present within the Wonderful. Ricky, thank you. It is so good to have you here. I got to tell you, Ricky is like my assistant. Always, always, always has great points. If you take statins, can you also use red yeast rice? You can. Desiree, you are going to increase your risk of muscle pain because the statins and the red yeast rice, they work down the same pathway, but you can, I mean, I have patients who do both. I think that if you're going to stick with the statin, it would be better to look into some of these other options. And guys, when you go to Regenesis RX in the education tab, I do have all of these supplements listed here. You'll see heart health supplements. Don't forget, if you're an app subscriber, you automatically get 10% off. So that's going to save you much. Do not forget to put in your discount code, but then just take out of your cart anything that you don't want. Most people would not take all of these supplements. All the ones I discussed here, that is not typical. That's only if you have a lot of problems. For most people, like omega-3 and turmeric, that's all they need, right? So you don't need the whole cart. I just put it all into one cart to make it easy for you, okay? A substance in black pepper is called piperine when combined with Curcumin and turmeric has been shown to increase by, yes, exactly. You're so right. How do we access your supplement discounts? Okay, Carrie, if you are in the app, send me a message. I'll send you the code. I'm not allowed to share it on social media or in these classes. These are public. Anyone could join them, and someone has to actually be working with me to get my discount. Designs for Health is a medical grade supplement company. Their supplements are potent. So they want to make sure that they're being used appropriately. They want to make sure that someone is kind of looking over your shoulder and saying like, okay, this is probably going to be okay for you. They don't want you to like start omega-3 if you're taking a bunch of blood thinners, for example, right? So they're really picky about that. So if someone is in my app where they have access to direct message me and say, hey, you know, is this going to be okay? Whatever. That's a lot different situation than me just like handing out a discount to everyone on social media. So I can understand their thinking behind that. I'm not mad at them for it. So if you're in the app, message me. I'll send you the discount. You're good to go. And then you can message me anytime with questions. I agree. So yes, I switched from simvastatin to atorvastatin and the side effects went away within 24 to 40. Could not agree with you more, Ricky. It drives me crazy. Every time I fill a simvastatin prescription, I die inside. What is your recommended CoQ10? Of course, Designs for Health, QAnon. I love it. Absolutely love it. If you want the CoQ10 by itself, QAnon is there. If you want the combination of the red yeast rice, it automatically has the CoQ10 there. That's another cool thing I love about Designs for Health is if something depletes something else, they combine the two so that you don't have to worry about that depletion. Okay, red yeast rice can be bad. Like me, I have vestibular migraine. Yeah, that's true. I prefer A2RAs to beta blockers as beta blockers could trigger cough. Yes, this is true. You make a good point, Ricky. Where do you find this recorded session? It's going to be in the education tab of regenesisrx.com. Thank you so much. Oh, thank you so much, Ricky. Thank you. Oh, thanks, guys. You're amazing. As far as niacin goes, yes, I think that it's best to take niacin with dinner. You can do it with or without food. I just tend to think that it's better with dinner personally. And then as far as the niacin dose, generally just 1 to 2 pills of that is going to be perfectly adequate for most people. Oh, thank you so much. I'm so glad you enjoyed it. Awesome. Awesome. Pharmacist Jamie's tips. Thank you. Do thyroid meds reduce magnesium levels? They can. Yes. I think that it's really important for someone who is on thyroid medications to watch their magnesium and then also their selenium. Those two kind of work together in order to support thyroid health. What does CoQ10 do for you? Okay, so CoQ10 is just an antioxidant, basically. So it's going to protect your body from free radical damage. It's going to give you the tools that you need to help prevent all of these inflammatory processes. As far as signs and symptoms of low CoQ10, I mean, they can be very generalized. Sometimes people will have low energy. They'll just have fatigue. They'll have slower wound healing, things like that. It's not something specific where it's like, as soon as someone tells me that, I'm like, oh, that's low CoQ10. It's more just the thing that we know that certain medications deplete the CoQ10, right? And we know that having CoQ10 is really important. So it's more about looking at your medication history more so than your symptoms, if that makes sense. Let's see here. Does having osteoarthritis increase your chances for heart disease? Ooh, that's a great question, Beverly. I mean, I can see how maybe it would because maybe you're less active if you've got osteoarthritis, and we know that physical activity is a part of heart disease. I haven't seen like clinical trials comparing the two head to head. So I'm not really sure on that one, to be honest with you. Oh, there, Ricky's got it. There's an association between bone density and cardiovascular disease, meaning the lower your bone density, the higher your risk of cardiovascular. Thank you, Ricky. Love it. Appreciate you. My heart rate 45 to 50, trying to get a pacemaker. Well, good luck with that, Michael. With the magnesium world so saturated, which is the best to take? The magnesium glycinate. Absolutely magnesium glycinate. As I said, the taurate is also extra beneficial for high blood pressure, but I just love the glycinate. It really covers all the bases, you guys. Yeah, especially chelated bisglycinate. They've got a great one from Designs for Health. They've got tons of great ones on labdoor.com. Magnesium is very, very important. I'm on carvedilol, furosemide, and potassium CLSR MCTB. Why does the warning state do not lay down while taking this potassium? Well, I mean, to be honest with you, that is interesting. I'm not 100% sure, Chuck. The warning state do not lay down. How soon after taking the potassium? I don't know. I'm going to have to look into that one. Thank you for the blood testing. No problem, JD. Thank you, Marsha. What would be a good test to see if you have high cortisol levels throughout the day? Okay, JD, so high cortisol levels, that can be determined. I like it best with a Dutch urine test because this tests your cortisol levels over 2 days. If you were there for the weight loss class, we kind of talked about it briefly. You can get a blood cortisol level, but that just shows like one little moment in time. So that's going to show what your cortisol is right that second. Probably not going to be elevated for most people. They're just going to get their blood drawn, whatever. But if you're someone with chronic cortisol, it could be. But the Dutch test has the advantage of checking you out in your normal everyday environment over the course of 2 days. So you're going to see, oh, my cortisol is spiking in the morning, or maybe my cortisol is low in the morning. That's why I wake up tired. And then my cortisol is spiking at night. That's why I can't sleep. So yeah, I do love the Dutch for that reason. Good morning and happy Sunday. Thank you so much. Oh, thank you. What cardiovascular supplementation can be considered for a patient who has renal problems after being diabetic for a long time? Okay, so as far as renal problems, I mean, Amanda, you really need to talk to your doctor about that. You could send me a private message and I can kind of talk to you about that a little bit. It depends on which medications they're taking and whatnot. Omega-3s, for example, are generally fine. You don't really want to be messing with electrolytes too much if you've got renal problems. I hope that they are taking an ACE or an ARB to kind of help with that. So yeah, that's more kind of specific, if that makes sense. Thoughts on metformin? Metformin can be great, Cliff. Metformin, really, really good at helping with blood sugar. Super cheap. That's a huge advantage of it. It can cause digestive side effects. So I always recommend that you request the extended release version and that you take it with food. That will greatly decrease your risk of diarrhea. But yeah, metformin is super, super handy. I'm on spironolactone 50 milligrams 2 times a day for hormonal acne. Is this safe long-term to be on? I get blood work checked every year. Kidneys, everything is good. Yes. Yes. So spironolactone, yes, I can understand why you would be concerned because it is a blood pressure agent. But when we see people using it long-term, we don't generally see increased risk issues. So for most people, it is going to be fine. Now, if you do start having some type of issue with it, if you've got something going on with your kidneys, of course, your doctor is going to change that. But we don't see spironolactone being a really problematic medication. Yes, I'm debating starting my son on this for his oily hair. Okay, so Misty, I don't know though about the spironolactone for a male. The problem with spironolactone is that it increases your breast size. So most women are all for this. Most men don't love it. It can basically be kind of a feminizing thing. Now at the lower doses for the blood pressure, not as big of a problem, but when we start to get into the higher doses for hormones, we can see that happen. So that's just something you want to talk to your doctor about. Not generally what I recommend for men with hormonal acne. Did you say magnesium glycinate? Yes, I did. Can thyroid meds, thyroid deficiencies also pose more risk? Absolutely. Someone who is hypothyroid is at much higher risk for increased cholesterol. Yes. So yes, you want to get your thyroid under control. If your thyroid is out of control, it's going to mess with everything. Yes, cardiovascular disease and cholesterol included. Thank you so much, Ricky. I'd like to it's Pharmacist Jamie's tips. Thank you so much, you guys. Oh, okay. There's the field of greens. Okay, I'll check that out. Okay, what is the CoQ10 again for the brand you recommend? That is RYR Synergy. So that's the one that has the red yeast rice and the CoQ10. If you just want the CoQ10, like if you're taking a statin, for example, so you don't really want to take the red yeast rice, then you're going to want to get the QAnol. Thank you. Thank you so much. I'm very much looking forward to breathing out of my nose and being able to eat solid food again. This has been intense. I'll say that. What causes high calcium in arteries and how can you reduce calcium? So calcium is part of what your body uses as spackling to cover that inflammation. It will combine the calcium with the cholesterol and white blood cells, and it's going to use that. Okay. So that's part of the picture right there, is basically just those injuries. That's going to increase the calcium in your arteries. Also, calcium supplementation can often do this as well. I don't like calcium supplementation unless you are under direct care of a doctor and they're monitoring that, because calcium supplementation is not well absorbed by your bones. A lot of times it tends to clump up in your arteries. Oh, thank you so much, Ricky. I appreciate you. Oh, there we go. Aw, thank you. You guys are awesome. If I may ask one other question, please. I am on 300 milligrams of gabapentin daily for severe back issues. I recall you are not a fan of gabapentin. Is this because of the health risk of taking it? Okay, so if you're taking 300 milligrams once daily, that is not a dose where I'm really freaked out. Gabapentin can certainly help in certain situations. When gabapentin is helpful and you're on a lower dose, I'm absolutely fine with it. My big problem with gabapentin is that it is way overprescribed. It is being prescribed to all kinds of people who it does not benefit. And then it doesn't work. So they tell their doctor, this isn't working. So what does the doctor do? Increases the dose. This makes no sense to me. I'm like, why are you taking something that doesn't work for this and you're just jacking up the dose more and more? And I'll talk to the patient and say, you know, you're taking a really high dose of this. You are taking like 12 pills of gabapentin a day. What's going on? And they're like, I don't know. It doesn't even work. So the doctor just keeps increasing it. That drives me nuts. Now, if you're taking one pill of gabapentin, you're not going to have near as much risk, right? That's not a high dose. And if you feel like it's helping, go for it. That is not problematic, Chuck. QAvail. Yes, it is QAvail. Where do I go to download the ebook? Go to regenesisrx.com and click the education tab. That's where I'm going to line up all of the webinars from now on, all of the free ebooks, all of that stuff. If glycemic control is not achieved with metformin HC extended release tablets, 2,000 milligrams once daily, consider a trial of metformin HC extended release tablet. Yes, absolutely, Ricky. You are so right. Yes, often splitting up the dose. And that's another thing about lisinopril as well. A lot of people just take once daily lisinopril. In clinical trials, twice daily lisinopril with half the dose is much more beneficial. So oftentimes it kind of sucks because you got to increase your pill burden. Now you're taking 2 pills instead of 1, right? But it's more beneficial. It helps you in the long run. So consider splitting up your metformin dose, your lisinopril dose, things like that. Okay, is magnesium safe to take on your own, or should a doctor monitor you? Karen, magnesium is generally very innocuous. It's not one that we're too concerned about. I always say it's best to check in with your doctor just to be on the safe side, but it's not like, you know, some of these you really need to check in with your doctor, like ashwagandha. Please, no one just start randomly taking ashwagandha. Talk to your doctor. It interacts with so many medications. It's a great thing, but you need to double check. Magnesium is much, much more innocuous. Okay, Ricky says, I'd only worry if you have kidney disease. Yes, absolutely, Ricky. Oh, thank you. Do you recommend the medications suggested by doctor for osteoporosis? Well, that is a little bit off topic, but we are absolutely going to do an osteoporosis class in the future. I'll tell you that. And I will say also for app subscribers, check out in the webinar section. I now have a list of all of the webinars coming up in the future so that you can kind of have an idea of the things that you're going to be seeing more of. And yes, we will keep voting on topics so that you guys can see what you want to see the most. Since my heart attack, I have started having difficulty in breathing at high altitudes, 5,000 feet plus, and was wondering if you have any recommendations. Okay, Jason. So obviously, you know, the air is thinner there. There's not near as much oxygen. So your heart is going to have to work a bit harder to get your body the oxygen that it needs. As far as recommendations for that particular situation, I don't know. It just kind of depends on everything that you've got going on. It kind of depends on what medications you're taking. If you have some type of heart failure where you need support in that way, you're seeing the effects there more so than at sea level because there's less oxygen available, but you still have the problem in both places. It's only showing up in the one situation because there's less oxygen. So it sounds like you may want to chat with your doctor and make sure that you're optimizing all of your medications and whatnot. You mentioned not treating low calcium. Is that in children and adults? My daughter doesn't eat cheese or drink milk, doesn't get much calcium, so I bought calcium. Okay, Carrie, so calcium is tough. Actually, interestingly enough, we don't absorb calcium very well from dairy. So the fact that your daughter does not drink cheese or milk, eat cheese and drink milk, that doesn't really make any difference because she wouldn't be getting calcium from those anyway. I know, guys, it sounds crazy, but we have like mountains of data showing that we do not absorb calcium from dairy. When we get calcium, it's from leafy greens. It's from other things. It can even be from protein sources. So yeah, calcium, your daughter probably doesn't need it. And the supplementation is probably not helping her. Now, you can chat with your doctor. You can get her levels tested if you want to have a completely accurate picture there. But yeah, I generally across the board recommend against calcium supplementation unless you are taking a bisphosphonate for osteoporosis. That is the one case where it may actually provide some benefit. Otherwise, I'm just not a fan. Menopause effect on heart health. Is HRT helpful to? Yes, absolutely, Heidi. So yeah, balancing out those hormones. Estrogen is very protective against heart disease. This is why women, their risk of cardiovascular disease jumps dramatically once their estrogen is bottomed out. So yes, HRT can absolutely be beneficial to help protect against heart disease and also dementia. So I am not opposed to hormone replacement therapy. How do we find out on future webinars? I have your app and follow your Instagram. Okay, Andrea, check out the webinar section. You're literally going to see a webinar schedule right there. So that's going to have all the info. And then anytime that we do have a vote, I will put that in there as well. And guys, don't forget, if you're an app subscriber, message me anytime. I literally check that thing like 20 times every day. Like, oh, does anyone want to talk? Let's chat. Let's hang out. So it just kind of gives me more opportunity to interact with you guys. All right. Oh, thank you so much, Elizabeth. It looks like that is pretty much the end of the chat. So I am going to go ahead and stop the recording here. One moment.